The title of my talk is Meta Perspective on Heart Rate Variability. Is heart rate variability antiquated or indispensable? And this is my quick disclosure slide. And the reason I titled the talk this way was to highlight the differences in views towards heart rate variability, the views that are often divided along occupational and disciplinary lines. So if you ask a clinician in healthcare setting, the response you get is that heart rate variability is antiquated. On the other hand, if you ask an athlete or a Silicon entrepreneur seeking to optimize physical or cognitive performance, they may say that heart rate variability is really important and indispensable. Personally, as a clinician and a researcher of wearable devices, I find this divide really fascinating. And I'm also acutely aware that the divide is larger than many will recognize, because many physicians are simply not aware that heart rate variability is widely espoused as a marker of health and performance, while many athletes have little idea how skeptical the medical community may be towards heart rate variability. The other day, I was listening to a podcast on heart rate variability, and one of the speakers was saying that heart rate variability is sort of commonly used in the clinical setting for diagnostic and prognostic purposes. And I have to say that's really not the case. And to show that, to illustrate this, in the hospital, we utilize something called the Xyle patch. It's an FDA-approved heart rate monitor, which you can keep on for up to 14 days. And when someone gets admitted to the hospital for syncope, which is loss of consciousness, chest pain, or palpitations, we send people home with this Xyle patch. And when you get the actual medical report, this is the actual medical report, actually it's a sample of someone, you can see that they present a lot of the information such as heart rate, events, which include arrhythmias, such as ventricular tachycardia, atrial fibrillation, sinus pauses, and various ectophies. But nowhere in there is there anything about heart rate variability. And you would think that with something like this device, which is a perfect instrument for heart rate variability, that would be included in this. But simply it's not included because its heart rate variability is not used in the clinical setting. The last time any medical professional society had put up a major position or a consensus paper on heart rate variability was in 1996. It was a joint statement put out by the European Society of Cardiology and the North American Society of Pacing Electrophysiology, and published in the two big journals, European Heart Journal and the Circulation Journal. And it sort of quickly went over, reviewed some of the literature and provided some guidelines. They talked a little bit about the methodology of heart rate variability, included time and frequency domain analysis, short-term versus long-term acquisition of heart rate data, and some of the reporting requirements, such as the ECG signal, the duration, the pre-processing that you needed of the signals. They also talked about the physiological correlates, including autonomic influences, the frequency components, and then some of the clinical applications. Actually, they only identified two. Post-myocardial infarction, so you could obtain heart rate variability 1 week after an acute MI, and that information was found useful to determine whether someone was at risk of arrhythmia or death. And then the diagnosis of diabetic neuropathy. Now, this was highly cited, but again, this was in 1996. The only follow-up of this paper was done in 2015. And it talked largely about nonlinear methodologies, which I won't be talking on this talk. It would be in subsequent talks for this series. And this basically, the same group, the European Society of Cardiology and another European Heart Rhythm Association, reviewed a number of heart rate variability nonlinear methodologies publications out of 800 plus, and found that 21 studies met quality criteria. And then these are sort of the various methods that were evaluated, including degenerative frequency analysis, Poincaré, deceleration capacity, acceleration capacity, entropy. I'm not going to go into too much details, but their recommendations was ultimately that traditional measures, which were discussed in the prior guidelines in 1996, remains the method of choice, and widespread use of nonlinear methods was not recommended. So this was the most recent update that was given by any sort of large medical professional society, and it was published in a much smaller journal called Europace, and it really didn't get much citations. So, clearly the importance of heart rate variability in medical establishment is in question, and so it hasn't been widely utilized. Contrast this with how wearable companies use heart rate variability and often consider it as a cornerstone for the app functionality. So Whoop is a well-known company that has its own device and its app, and they have a measure called Whoop Recovery. And one of the cornerstone of this measurement of recovery is heart rate variability, in addition to resting heart rate, sleep, and respiratory rate. And this enthusiasm towards heart rate variability is not limited to wearable world. In fact, heart rate variability has garnered a steady rise in interest in the actual peer-reviewed sciences. And if you do a literature search on the number of heart rate variability related publications, you'll find that there has been a significant increase over the past 3 decades, even more so than you would anticipate based on the rise of number of journals and the growth of science alone. So where does the truth exist, and why is there such a contrast in enthusiasm here? And some of the hints as to why this growth has occurred, and maybe how some of this disparities and this differences in this perspective of heart rate variability has arisen from, is you can take a look at the number of publications by discipline. And so what I did here was I took the number of publications divided according to discipline by decades. Into 1990s, you have 157 total publications, 1980, 460, 1990s, 7,000, 2000s, about 15,000, heart rate variability in 2010, about 28,000, and then just in the 2020s alone, which is just 2020 and 2021, already we have nearly 5,000 publications. And if you take a look a little bit of the patterns of this heart rate variability publications, you could notice that in the beginning, the 1970s and 1980s, obstetrics history and gynecology was the leading discipline that published in heart rate variability. And why is that? It was because fetal heart rate monitoring was sort of became popular and now has become the standard practice. And you could see that obstetrics and gynecology is no longer sort of the prominent discipline that publishes in heart rate variability. Then came the cardiac and cardiovascular fields. And in the 1990s and 2000s, they essentially dominated in publications in heart rate variability. And then the domination slowly sort of withered away, and then they lost their lead in 2020. And if you take a look at the neurosciences, you can see that in the beginning, they're continued to be present throughout the decades. But in the beginning, in the first 3 decades or so, a lot of the focus was on sort of autonomic nervous conditions, such as diabetic neuropathy, the reinnervations of transplanted hearts, and some other autonomic nervous conditions. But then later in the 2010s and 2020s, the reason it really sort of gained prominence was because of the development of neuroimaging and neurotechnologies in the recent decades. And then you can see that engineering and biomedical came into view in the 2010s and 2020s, and then sports science also became significantly important. So the goals of this talk is to appreciate how science of heart rate variability has evolved over the past 50 years, recognize the various ways heart rate variability is measured, obtain a basic understanding of heart rate variability physiology, and to understand how different perspectives of heart rate variability has emerged. To sort of illustrate the way I interpret how heart rate variability has evolved over the years, I have put together the 5 stages. And this is based on the prevailing scientific paradigms that existed in each of these stages. And unfortunately, I won't be able to go through all of these 5 stages. It will probably take 3 talks overall to go over all of them. But I think as of today, we'll just largely focus on part 1, understanding heart rate variability. And the stages are, first, understanding heart rate variability, and then heart rate variability as a marker of autonomic nervous system, then heart rate variability as a marker of body-wide function, heart rate variability within the construct of mind-body interaction, and then finally the heart rate variability itself as a desirable target.